Good morning, ladies and gentlemen. I would like to welcome all the media attendees and all of the distinguished members of the different organizations that are listening in through the internet. I want to remind the media attendees that you have the ability to submit questions during this event, and these questions will get relayed to us, and then my panel and I will be happy to address those to the best of our ability at the end of the presentation. I would like to introduce the panel members. Dr. Chuck Fox, Vice Chancellor of Clinical Affairs at the LSU Health Science Center here in Shreveport, and Chief Medical Officer of the Ochsner LSU Hospital here in Shreveport. Dr. Chris Kevel, Vice Chancellor of Research here at the LSU Health Science Center in Shreveport, and Dean of the School of Graduate Studies. Mr. Andrew Mouton, Chief Innovation Officer here on our Health Science Center campus. Dr. Martin Sapp, Chairman of the Department of Microbiology and Immunology. The primary purpose of having this presentation today, or this public announcement, is to update the community about the Health Science Center's role in combating this invisible enemy, this pathogen, this virus, which has been referred to as a coronavirus. And many of you that aren't even physicians or scientists know more about this than many physicians and scientists knew about this just a month ago. It's also known as COVID-19. We're going to really talk about two roles here this morning. One is the role of providing doctors and trainees that work with our clinical partner, Ochsner Health System, and I'm going to have Dr. Fox make some comments about that in just a minute. But equally important, if not more important, is to discuss really this new emerging viral threat lab that we now have in our Health Science Center. We have top scientists in the world here on our campus, particularly in the virology department, but really in all the basic science departments. And Dr. Kevel has led that charge with others. Someone says, what is this COVID-19 testing lab? We came up with a sexy name, right? The Emerging Viral Threat Lab. But I'm not sure that's really sexy. I think it's probably pretty apropos to what is really threatening our society. This is really incredible timeline, and I don't want to underemphasize the role that the basic scientists on this campus have had under Dr. Kevel's leadership. Let me just kind of give you a quick timeline. Around the 12th of March, this whole thing was a little bit of a twinkle in the eye of a couple of the esteemed virologists. Dr. Urachko sent an email to Dr. Kevel. You know, this virus is very, very, very similar genetically to the viruses that we tested for SARS here, which we were a leading area in that study on our campus here. Around the 17th of March, I approached the governor and said, Governor, we have a few roadblocks to this and we need your help. Without any question, he jumped right in, created an executive order within a matter of 2 days. So now we're around March 20th or so. By March 25th, today, actually yesterday, but today, the lab is up and running. And I don't want to get into too much detail about what the lab can and can't do, but I will leave that to Dr. Kevel. We talk about this pandemic and what the effects of this pandemic is. And I'm going to share with you just a couple of sobering numbers as to why our docs are working so hard with our clinical partner, the Ochsner Health System, and why our other set of docs are working so hard in trying to find a way to get a rapid test out there that is available for the community and to have possible treatments for this. yet alone a vaccine hopefully in the near future. The governor just this past weekend issued his stay-at-home order, which is effective till the 12th of April. It may or may not be extended. Despite that, we still have in Louisiana the fastest growth rate of confirmed cases in the entire world. This was a study by ULL. We're number 3 in the U.S. in per capita cases. In the steepness of the growth curve of this disease process in Louisiana really parallels that of Italy and Spain. It's pretty scary. I know up here in North Louisiana, I still see people running around, shopping with impunity, hanging out. This is unacceptable. And if you look at our colleagues down the southern part of this state, you know, Dr. Fox and I were just discussing this a little while ago. It is scary. It is scary. We may have to send some docs down there to help out. This is how scary it is. So these are really sad facts. The governor has emphasized it, and as a result of this pandemic and its effect on Louisiana, the governor filed for a federal disaster proclamation, which has been approved by President Trump as of yesterday, and so that hopefully will provide additional aid at the federal level to our state. So I want to, at this time, invite Dr. Chuck Fox to come up here and discuss the role of our doctors and our trainees with our clinical partner briefly before we go into the major portion of this, which is the discussion of the emerging viral threat lab. Thank you.
Thank you, Dr. Ghali. I think this really sort of solidifies the importance of an academic medical center to a community. I mean, the ability for our basic scientists to step forward, to want to step forward, to have the knowledge to step forward, to have the capability to set this up. I mean, this is a massive undertaking that they said, we're going to do this. And to echo, Dr. Ghali's comments, have all this up and standing in 2 weeks, Martin, Drew, Chris, phenomenal. But the community should really be reassured by the depth of talent that we have, all the folks that are available when we go through a pandemic like this. It really shows just the incredible talent that we have in this community, and we're really grateful for everybody working. On the clinical side, I'll share a story with you, keeping communication with medical providers all over the world. I do think we have some advantages, and I'll talk about that in just a second. But made a phone call out on March 14th to an individual providing health care down in New Orleans, and I was asking him about the COVID situation down there, and he said, maybe have a presumptive positive case in the hospital. That's about it. Fast forward March 21st, when I called, all I heard were alarms in the background. Obviously, he was in the ICU, and he told me that they were now opening up a new 30-bed ICU for all the activity and all the clinical needs that the community had. So very dramatic change in a short period of time. So Martin, I learned quite a bit about the rapidity of the viral spread. And I think that unfortunately, if you look at Italy and a lot of what's going down in New Orleans, the ability to test earlier would have been very, very helpful to keep certain patient groups out of harm's way. So I know in Italy, you get into situations with the ICU where you have 20 patients, you take in another 20 patients, some of which are COVID positive, and it would have been nice to have the ability to segregate those patients. So if we'd have had testing up and running in some of those sites, I think it really would have been helpful at decreasing morbidity and mortality for a high-risk group. So I really commend you yet again, this capability to test the patients in the hospital. We're having delays with some of the results coming back. I think Ochsner has done a fantastic job on the supply side and organizationally sort of letting us know what's coming up and what we need to think about and how we need to move things around. So I think they've been a wonderful organization to be partnered with through this. And this truly is, stronger together. I think the two entities ramped up working together have done phenomenal things. And I think the community of North Louisiana should know that and hear that. We have over 1,000 physicians, so 500 residents and fellows and 500 attendings in our organization. And we've had frequent WebExes with them over the past 2 weeks, both from the hospital side and the med school side, really trying to get them to understand that this thing evolves and jobs evolve and duties will change. So if you're a gastroenterologist today, you may be a hospitalist tomorrow. If you're an anesthesia resident today in the OR, in a week you may be an ICU resident, and the same for the attendings. We've tried to come up with a feasible plan in the OR, and I think it's working well. I think the group has done a great job of managing a lot of the information that gets puts out pretty quickly. So it's hard for a big organization to turn on a dime and to go from doing certain number of cases and then figuring out what we're going to do, going forward. I think they did a great job. All the surgeons did a wonderful job of managing that last week. I think we're down to the essential cases that need to be done, and that's what's being done. And we're deploying those attendings and residents in other venues. I think this week, really, it's been all about conservation of personnel. So we've got a lot of folks here. There's only so much clinical activity that's needed right now. So we've asked the departments to come up with a list, a way of doing shift work if possible, but to get some folks out of the hospital because this could be a long period of time that we're going to work through. The other thing we're doing this week is really trying to bring some sense to the clinics, who should be seen in the clinics. We're going to have a need to leave the clinics open to some extent because we do have folks that have urgent needs that need to be seen, need medical care. We don't want to overrun our ERs because they have become hotspots all over the world in these hot zones that have experienced a lot of COVID-19 activity. So I think we've got a pretty thoughtful plan going forward. And I think a lot of this testing that's coming out now from the LSU group, Ochsner is going to start doing some testing, I think, next week on campus. So it's really going to give us a lot of advantages. Chris, I would say there's probably only 20 academic medical centers in the United States that have the capability of doing this in-house, through their basic science departments. So I think it's just a wonderful job done by our basic scientists. I think it really illustrates to the community just the depth of talent that we have here, and we're thankful to be on this journey with you guys. So I'm going to introduce now Dr. Chris Kevel, who is our Vice Chancellor for Research. And Chris?
Thank you, Dr. Fox, and thank you, Dr. Ghali. As everyone has learned over the past two speakers there, we really are in a very unique position here at LSU Health Sciences Center in Shreveport. Some of you may have seen recently a cartoon that was published recently by Mike Ludovich that actually shows a version of the raising of the flag at Iwo Jima. And when you see that cartoon, you see first responders, nurses, doctors, and then scientists at the back lifting up the flag. That is truly the kind of paradigm that we find ourselves in here at LSU Health. So certainly while this is a very somber and serious time, it's also a very exciting time because now, for the first time, we're really going to begin to take the fight to the virus. So as many of you know, and have probably heard through the media, one of the key ways to really combat Corona-19 is to test. That will allow us to identify individuals who are positive, and as Dr. Fox just mentioned a moment ago, segregate out the hospitals so that we can keep those that are COVID-19 positive away from those who aren't, and then break the chain. That is the way we can really begin to mitigate and minimize the impact of this virus in the population. I won't speak too much more about the virology because Dr. Martin Sapp will come and tell you more about that in a moment and tell you the uniqueness of this laboratory for our Health Sciences Center and why this is a game changer, not only for North Louisiana, but the whole state. The one thing I would like to tell you is that this is by no means a small endeavor. As Dr. Ghali said, it was March 12th at 3:34 p.m. that I originally got the first email from Dr. Urachko, and then a day later forwarded that to Dr. Ghali, trying to figure out, could this even be possible here? With his vision and his leadership, and more importantly, understanding of the crisis that was befalling us, he quickly acted to see if this was possible. From there, engaging both the virologists and other research team members, Mr. Drew Mouton, who I'll tell you a little bit about in a moment, I tapped him to be the team leader to stand up this team to build this laboratory. To give you some perspective, there's been well over 45 individuals that have been actively involved in making this lab a reality in 12 days. And this, by the way, has received certification and approval from CMS, CLIA, and CDC. So we really are ready now as an institution to take the fight to the virus in conjunction with our clinical partner, Ochsner, and really begin to move the needle in taking care of individuals here in Louisiana. So without any further ado, I'd like to go ahead and introduce to you Mr. Drew Mouton, who actually was, as I said a moment ago, responsible for leading the team and orchestrating the lift of the lab. Mr. Mouton.
Good morning. Thank you, Dr. Kevel. Like many of you, last month we were watching as cities and countries were struggling to deal with this virus. Our virology team, however, I think took the approach of if we can do something, we should, and started the process, as others have mentioned, of figuring out what we can do from our campus. And we're lucky here to have, as Dr. Fox, Dr. Ghali, Dr. Kevel mentioned, a really world-class team of virologists that have decades and decades of experience dealing with this problem. But we made this decision, as has been mentioned, less than 2 weeks ago, to stand up what's called a high-complexity genomics laboratory. And this is typically a 6 to 12-month process. I am excited to report that less than 2 weeks later, we started processing human test samples yesterday. Our intent from the beginning here was to contribute to the extent possible to the extreme constraints that we see across the country in testing capacity, but more importantly, to make sure that we could stay in the fight if the fight changed. This is the current virus. This virus may change. Our ability across the country to address it has been, as many know, constrained by equipment, by expertise, by test kits. So what we decided to do here was to build a very flexible system that is really based around the gold standard in genomics testing. We use something called viral RNA extraction and PCR amplification. This is the standard for doing this kind of testing in the world. It means that the sensitivity of our test is, quite frankly, among the very best in the world. It's also, in most cases, very expensive to develop. It requires very deep skill sets to get this thing done, and highly skilled individuals to operate. I think it's a testament to the phenomenal work ethic and amazing skill that we have on this campus that we were able to pull this off in such a short period of time. And as Dr. Kevel has mentioned, I think it's very, very important that we don't couch this as celebratory in any way, but this is our ability to essentially punch the virus in the mouth. And we're taking a stand in trying to contribute to this public health crisis. By my count, there were 50 to 60 people directly involved in this over the last 2 weeks. There are dozens more that provided a support role. I'm happy to be able to identify some of these here. First, Chancellor Ghali and Dr. Kevel really have been like bulldozers and road graders clearing the way for us to get this thing done and making it safe for us to travel forward. Our support team at the governor's office and at CMS also has been just extraordinary in enabling us to do the things that we need to do to let the scientists be scientists and move this initiative forward. Our support team here, our facility supports teams led by Mark Gibson, Pat Murphy, and Kenny Brown also have been just extraordinary. There's an unbelievable amount of hardware, software, supplies that have crossed the threshold here just to get this thing done, and these folks have been extraordinary in compressing 2 months' worth of work into basically a week. Really exceptional. The core of this initiative, as has been mentioned already, is our virology team here, and specifically the entire laboratory groups of Dr. Martin Sapp, Dr. Andrew Urajko, Dr. Rona Scott, Jeremy Camille, and Dr. Michelle Arnold. And I will say the entire laboratory groups here. If you go into our lab right now, you will see their teams who have completely shifted their focus in order to support this initiative and conduct the testing that we're doing right now. They have been exceptional. I should also mention that our executive research team here, specifically Mrs. Anella Nelson, Mrs. Kavanaugh, Mrs. Kraft, Ms. Williams, Mr. Malloy, and Dr. Tatchell, all of them could have been home with their families for the last couple of weeks, and along with most of the rest of us have been pulling 18 and 20-hour days to get this thing done. Specifically, I want to also name Dr. Ellen Friday, who runs our Feistweiler Cancer Center Genomics Lab. She dropped everything she was doing to pick up the compliance and standard support side of this and make sure that we can run this laboratory in a way that is appropriate and continue to do so and produce great results. Lastly, I want to point out that sometimes support comes from unexpected places. Dr. Paul Weinberger runs our Center for Airway, Voice, and Swallowing. Dr. John Vancheri is our Chief of Pediatric Infectious Disease. They have put on their software developer hats and have developed a package of software to run our laboratory management systems, really doing what's needed to get this thing done. There are many, many others, I think, who've contributed to this effort that will become, I think, more apparent over the next couple weeks, but that is a number of them. I want to mention that a very good friend of mine this morning sent an email that closed with the line, "Go forth and conquer, for the world is small, but you are a giant." And it is my pleasure to point to one of our giants on our campus and introduce Dr. Martin Sapp to discuss some of the technical details of the laboratory.
Thank you, Drew. Thank you, Dr. Gali, Cavill. Thank you, Chuck Fox. Yeah, this has been quite a ride, I have to admit. This is something that I did not see myself doing 2 weeks ago, definitely. But before I go into the specifics of the Emerging Viral Threat Laboratory and its capabilities, I really need to thank a number of people. And, you know, we have thanked you, Dr. Gali, you, Dr. Cavill, Dr. Fox, and Drew. I mean, you have been just amazing. This is something that I never had envisioned to be happening here. But the most important thanks I really go out to my people in the Department of Microbiology and Immunology, and to the especially to the people of the Center of Molecular and Tumor Virology. And actually, Dr. Vancheri and Dr. Paul Weinberger are actually part of that Center for Molecular and Tumor Virology. So it encompasses basic scientists and clinical researchers, and it's really very nice to see that they all came together to form this team. I always knew that we had plenty of outstanding virologists in this institution, and I always knew that they were able to reach out. They're reaching out to their colleagues throughout the world. What I didn't expect and didn't know and didn't realize was that we were able to work as a team towards a common goal, and that this common goal can actually be achieved in such a short period of time. This is, I mean, I still don't really understand how this has been possible. So, I mean, the work ethics, the flexibility, the creativity, but also the organizational skills that go into this endeavor are just amazing and wonderful to watch. I'm really happy and proud to be part of this team. So now to the design and capability of this lab. Of course, as you know, I mean, the testing lab was really set up in response to this outbreak by the SARS coronavirus 2, which causes the disease COVID-19. So there's a little bit of a nomenclature issue here. So SARS coronavirus 2 is the pathogen, the virus causing COVID-19. So we built on the expertise that was developed at this institution by actually Dennis O'Callaghan and his colleagues over 30-some years. And we took advantage of the interactions and connections that we had as a team to people outside. So Dr. Yoroshko, Dr. Camille reached out to people at Yale, UWash, UAB, and actually to the Charité in Berlin in Germany to get information regarding test setup, test development, what are the best reagents to use. And so we were able to actually get all that information brought to us without us having to go into and reinvent the wheel pretty much. So this really allowed the rapid development of this testing system. And you have to see that this is happening in an environment where there's constant construction going on, right? Constant interruptions. And so this is, this requires the people to work at night, right? And so they come in at night to set up the test, to validate the test, and to complete the task that we have been given. So it's really just 12 days ago, I think, or 13 days ago, that I got the first call from Dr. Cavell on a Friday afternoon at 4 p.m. discussing the possibility, can we do this? And we said, sure, after some thinking, we said, yeah, we can do that. We can provide you with test capabilities of 10 to 50 tests a day, maybe in 2 weeks, right? So where are we now? We now have set up a lab, thanks to Drew, that has a testing capacity of up to 1,000 tests per day, with a total test cycle time of 6 to 8 hours. And if you don't get too many samples, actually a turnaround time, we think, of 24 to 48 hours. There's some handling logistics involved in all of this, which is not easy to do. And I think the integration into the software, the hospital software is still ongoing. It's not that easy, actually. So this is outstanding and amazing, and we will provide the service to our partner hospital, to local hospitals, regional hospitals, and to the community. And I think it will be a game changer with regard to controlling the spread of this virus and also triaging the people that come to the hospital and make sure that we don't group uninfected with infected people. In my opinion, however, one of the most important aspects of our lab design is actually that it allows a very quick adaptations to mutations of this virus, to the detection of other viral pathogens that might happen in the near future or in the farther future. And because we have developed a lab design and a testing design that is rather open, so we can draw different reagents from different companies, so we are not stuck to a specific company. We are not stuck to the development of a specific test by this company. We have really an open testing system here. So this is unlike certain commercial systems that really are wholly dependent on the availability of pre-made kits. We are making our kits ourselves, right? And so we can adapt easily. We all know, and I think you all know, that outbreaks have occurred before. I mean, we have heard about the SARS outbreak 18 years ago, which was luckily contained, a virus very similar to the current one. We have heard about the MERS outbreak, which is still ongoing, actually, but it's also been rather contained because it's not very infectious and contagious. It was just 8 years ago. We heard about Ebola virus outbreaks just 6 years ago, right? Also coming into the United States. And we think there will be further outbreaks down in the future. I think it's just a matter of time, and we cannot predict the timing, we cannot predict when it occurs, but we will definitely be able to say it will occur again, wherever it might originate from. It's just the travel, the globalization, and also, I think, our invasion of nature that going to make this happen. Being prepared for the detection of new pathogens allows for faster response by healthcare responders, by the government, which can mitigate or even completely prevent an event like this one happening now. And so we truly believe that the investment that has been made here into this, the establishment of this lab, which is not a small investment, right? Money is provided by the institution and I think by the government, will really benefit us down the road and will and the potential benefits really gained from its existence will be unmeasurable, probably. So I hope that we weren't prepared here for this outbreak. Clearly, we were not prepared. We hope that we'll be prepared for future outbreaks. Thank you.
Fantastic. Thank you, Dr. Sapp. I want to thank all of the folks that came up here and made some comments. Dr. Sapp is absolutely right. Even the giants of today stand on the shoulders of previous giants, and would not even be fair to not give Dennis O'Callahan a huge thank you for all the contributions that he's made in developing what Dr. Sapp was able to inherit in the Department of Microbiology and Immunology here in Shreveport as one of the leading virology centers in the world. This is not a small undertaking. As many of these guys said, the contacts were made not just throughout the state, not just throughout the country, but worldwide to get information, to collaborate. It's really this was really a heartwarming event, and so I really thank everybody for the support that they've given this from the governor down. It was just really heartwarming for us here on this campus. And so what this means is that we'll be able to, and I don't know if Dr. Fox mentioned it, but just from a practical standpoint, what we're having to do now, not that we want to do it, but what we're having to do is, patient will come in, we run the test, because they're presumably positive until we can determine whether they're definitively positive or definitively negative. We're having to isolate those patients. Well, that uses one of these rare isolation rooms or negative pressure room, whatever you want to call it, and it's an isolation room. And those are at a premium, number one. Number two, we're having to don all of the nurses, the respiratory techs, the residents, the attendings are all having to wear full protective garb when they go in. Well, we all know, because everyone is using this protective garb worldwide, that it's at a premium. So having a test that doesn't take 8 to 10 days or 5 to 10 days to come back, but can be done in 24 to 48 hours, and is a reliable test, is critical. And so that would really cut down on the number of patients that need to be admitted, cut down on the number of patients that need to be isolated, cut down on the number of patients that would require PPEs or that high of a level of PPE. May go in with a regular mask, but not necessarily an N95 mask. And I do want to just say Dr. Sapp and Drew and Dr. Kevel kind of touched on it for a second, but quantitatively, this test is, great. But the qualitative aspect of this test is that it can look at different mutations in this virus. And this virus has, what, Chris, some 50-plus mutations so far, maybe more. Who knows? Martin, do we know how many mutations so far? Yeah. Yeah, they're constantly mutating. That's why you always end up having a cold every year. Even you think you're going to get a cold, you're going to be immune to getting a cold, but you get it because it constantly mutates. So anyway, I really appreciate everyone in the audience online for participating, and I think we're going to receive some questions. Is that right? Megan is going to give us. There's been some questions submitted, but maybe one we'll start out with here. and maybe Dr. Kevel or Drew would like to address this question. What, y'all can come up here, whoever, what exactly does a testing site mean? Do people come to this location to get tested? What happens during the testing process? Those kind of questions.
So to answer the question regarding the test and the aspects of the test, so this testing site will be able to receive samples or specimens that come in from various different places, whether it's our partner hospital here or whether it's some other outside source, and the lab will be able to run that test and turn that test around in a very rapid order. This does not mean that people come to this location to get tested. There are other testing sites that exist and other testing protocols that exist. So the reality is the current CDC recommendations of who gets tested and who shouldn't be tested are still in place. As everyone spoke a moment ago, this will really help the healthcare providers identify individuals who are positive for the virus so that they can make proper decisions and handle them not only in the hospital, or perhaps identify them and say, go home, take rest, and then we'll check back with you later on. What happens during the testing process? As I mentioned a moment ago, the test specimens, come in from a site where they've been collected. And as was mentioned earlier by Dr. Sapp, these specimens are extracted for the viral RNA, and then that viral RNA is amplified using a scientific technique, very highly complex technique called PCR, polymerase chain reaction, where that test can determine the actual amount of virus that is in that specimen. So what one ends up getting is a viral load. So outside of just having a positive or a negative, we're also able to determine the viral load. What happens if someone gets a positive or negative result? That is going to be dependent upon the individual plus their healthcare provider. Their healthcare provider will make the appropriate decision on what that individual needs to do next, and the healthcare providers will receive all of the appropriate test results from our laboratory that will enable them to make that decision.
And one other quick question, Dr. Kevel. Do we anticipate being able to run hundreds of tests by the latter part of this week?
So the number of tests to run, as Dr. Sapp just mentioned, we're employing robotics, state-of-the-art, high throughput, high efficiency robotics, but that takes some time to amplify up. We're beginning now with in the neighborhood of about 50 tests per day, and by the end of the week, hope to really significantly increase that number, but have to get the robotic onto the point of cycling through multiple tests. We fully anticipate and plan with a week from now to certainly be in the hundreds of tests per day range, with the idea of going even higher and pushing that envelope within the next 2 weeks.
You see, these guys are clones of Dr. Fauci. So what basically, they're not going to do a test and give you the results unless they're a 1,000% certain that it's accurate. And so that's the situation. Dr. Fox, describe the ideal candidate for a test.
So right now our testing criteria are pretty tight. We had a limit number of tests that we could perform. And so our current criteria, and I think this will change as testing becomes available, I think our criteria will morph as our situation up here morphs. We'll have to be, and we have the ability to do the test. I think, we're going to really take advantage of that. So right now, testing criteria, fever greater than 100.4, respiratory symptoms, and then along with that, either an individual that is pregnant, immunocompromised, a healthcare worker that has had a known exposure to a COVID-positive patient. We're also looking at infants less than 10 weeks, and those are currently the criteria that we're using or actually there's one more additional, and that is folks that live in shelters that have a fever and respiratory complaints are the ones that we're testing currently at our facility.
And as this evolves, the governor has set up several sites around the state for the unfortunate homeless folks. And the one closest to us here in North Louisiana is at Lake Bistineau, and we've made a commitment to provide testing for those individuals as well. Most of that will be through our partner, Ochsner Health System, and we'll be collaborating with them on running those tests for them. Megan?
Yes, we have a couple more questions. Is it anticipated that other academic centers in Louisiana will be opening up their own testing centers?
In Louisiana, we're not aware of other academic medical centers that are currently planning to do such things. We've heard that Tulane University may be in the process of planning to do that, but we haven't spoken with them directly. We've heard that secondhand. There are other academic medical centers across the United States that are trying to do this. University of Oregon is one. Dr. Urajko and SAP have been in correspondence with them lately, and they were actually quite surprised how quickly we got this off the ground. However, one of the things that's critical is that you really have to have the virology expertise. That coupled with the scientific expertise to run these highly complex tests.
Awesome. This is probably another question for you, Dr. Kevel. You mentioned the viral load. So Brenda at KTBS would like to know, is being able to determine the viral load unique to our EVT lab?
No, the viral load can be determined by the PCR assay, so it's not unique to our lab. Other labs will be able to do that. What is out there in the media is a plethora of different kinds of tests. This is the gold standard, if you will. This is the test that the CDC recommends and endorses, and the World Health Organization. So we will be able to clearly determine the burden of virus in these individuals, whereas some of the other tests that are coming online are very rapid tests that really just give you a relative positive, if you will, without delineating the degree of viral burden.
Great. And then how many students, staff, researchers will be running this lab daily, and how many hours a day will it be operating?
I'll ask Mr. Mouton to come up.
Okay, great.
Yeah, so for our laboratory process, there are two very distinct components that I've mentioned already. There's an extraction component, there's a PCR amplification component. And as is mentioned before, we're embracing a semi-automated process where we use robotics to make some of this happen. Having said that, our extraction process will be run 24 hours a day, essentially starting today. That is the rate-limiting step for the way that we process these samples. Our PCR and amplification process will be a little bit more staffed variably. But all that said, we have a staff of approximately 30 that will be spread across across 3 shifts a day that will be active over the next week or two.
So I want to thank everyone and let you know that we will be having another one of these next week to update on the progress of the lab, and also on some progress that we're making on some clinical trials directed toward COVID-19. And I think you'll be very, very interested in hearing about those at that time. And I think right now, the question is, will testing be available for outside institutions, hospitals, and things like that? The answer is yes. I mean, if I had 500,000 tests, I'd test everybody in this part of North Louisiana because there is some value epidemiologically in knowing exactly who has it and who doesn't, what their symptoms are, what their symptoms are not, and to give you a better understanding of what the true morbidity versus mortality rate for this disease is. I will tell you that the most important thing is to heed the order of the governor, and please try to practice some scholarly level of social isolation. That is the most important thing that you can do. We can show you many, many steep curves of countries that did not do that. That is a real problem. So I want to just thank everyone for attending today. Be safe. I want to thank all the participants that were here today and everyone in the audience. God bless everyone. Thank you.